that might take the whole 15 minutes, right? And then if you want to go on to do the other two, and each of you can choose how you want to choose it. So I'm just going to, so we're kind of in a secure, I think. So just as we're kind of receptive to each other and there's good eye contact and there's sort of a friendliness, feels like, in the relational field, just tracking how that is.
So I'm noticing some like expansion in my chest. And I notice deeper breaths coming.
Deeper breathing, yeah.
I feel like I'm settling into the chair a little bit more.
So grounding a little more, settling.
And feeling a smile on my face.
Yeah. Yeah, you're very radiant, actually. Yeah. So just enjoying that, right? Yeah. And I know we also know we're going to do this exercise, and we know that it's just pulling on history. Just for a moment, and this can be very, very, very brief. I'm just going to go into still face just to track what your reaction is.
I don't like it.
Yeah, no, it triggers a lot. So, and I did that a little bit longer just a little bit longer. So just notice what happens, and just track what happened when there's no facial expression. And I'm not going to go back into having facial expression now while we're tracking.
So I could feel like my lip quiver a little bit, and like a real tightening in my gut right here, and kind of an unpleasant sinking in my stomach.
Yeah, so a lot of cascading of negative experience. So let's go back and repair that. We know this is just an exercise, and I don't feel that way, and I don't normally look at you that way, but we're in the exercise, we're seeing all that implicit information come up. And so I'm going to be talking to you because I want to repair this state, but I want people to listen to what I'm saying, because if you had a highly neglectful parent that didn't have much emotional awareness, or a depressed parent, or somebody that had kind of flat affect, sort of death mask, it is a threat signal to our attachment system. So even if they were loving underneath it all, you're getting that information and it comes in a certain way that's painful. Yeah. So let's see if we've recovered from that now that we're kind of naming the exercise. And and it may take some of us longer to recover because it ties into more memory that we haven't looked at or processed yet. So it's our second time around. So and just to notice, to feel what happens as you recover, because I wouldn't normally look at you like that, right? But then we're trying to separate like what's happening now with you and me versus what might have happened earlier, and it may not even be something that happened a lot. It's just that particular way of making our face sort of blank is a threat to the.
Scary.
It's scary. It's a threat. It's, even though I'm not I'm not acting aggressively or anything, but that's still just the face itself can be read that way. So, and as we're talking about it, how are you feeling about coming back?
So I feel more life, more opening up in my chest.
So there's sort of a recovery.
Yeah.
Your spaciousness in your chest is coming back, some expansiveness. And how is it for me?
And a deeper breath.
And a deeper breath again.
Yeah.
So you're noticing your markers for regulation.
Yeah.
Right, there's the markers for distress, and now the markers for regulation. Yeah, beautiful. So would you like me to try another facial expression, or do you feel like this is a good place to
I can do another one.
Okay, so do you want to?
It's so interesting.
It is interesting, to really bring your curiosity to it. But I really want to make sure you're not ending up with a big projection or transference on the person you're doing the exercise with. So we want to make sure we repair. So would you like me to try sadness or anger, or?
Anger.
Anger. Yeah.
Like a huge knot.
Yeah. And that was pretty brief.
That was pretty brief.
Yeah, but it doesn't take long. This is fast circuit learning. So just now that we're coming back to friendliness, and I'm going to reiterate that this was just an exercise. I'm not angry at you. I think you're wonderful. We're doing.
I could feel some heat too with that knot. Then a lot of
like a flooding of heat.
Yep.
Yeah, and sometimes I think heat comes as a nervous system arousal feeling, and sometimes I think heat mobilizes the action. It's the beginning of mobilizing action. Like you're fueling up for, I'm not getting out of here, or I'm going to punch this person in the nose, or whatever. There's different reasons I think the physiology shifts to heat. So just as we're talking about it, and we're back into more of a friendly interchange, and I notice the eye contact feels more okay, and what's happening
and I could feel myself taking that breath, and I feel like I'm settling in, like it almost feels like I'm spreading out a bit.
Yeah. And just to begin to remind you, this is just an exercise, and we're finding out about implicit memory, and we're doing good. Okay? So just notice how the relational field feels.
It's all repaired. It's all good.
Okay. So in an ideal scenario, everybody's going to end on repair. Okay, may not always happen ideally, but in an ideal scenario. So does that make sense for folks? And if you have a client that, this could, you just have to know that you do this facial expression shift very, very briefly. I even did the still face a little longer than I probably would normally do it. So just really brief, and that's all you need for the implicit memory to start. Thank you so much. Thank you. Yes?
So would you ever, when you did, the...
I'm just going to give you a microphone here so everybody can hear you. It's hard to hear in this room. Yeah. So put it right, it has to be almost like on your mouth.
Sorry.
There you go.
So when you do that exercise, do you ever, with your client...
Put it closer.
Okay. Do you ever, say, what's coming up for you memory?
You certainly could have this abridge into a whole session.
Okay.
Because I could have asked, this isn't the purpose for right now, because we're just going to see implicit, but you certainly could. You could say, well, what associations do you have with that? Do you remember ever that look before, or anything contextually, or what age you were, or, you can go all the way into working with the child state, or whatever associations they have with it.
Tim,
usually it's right there.
Yeah, I didn't know if you,
Just real quick. So we're actually going to do that. We're going to have it a bridge into a full session, and we can do you establish secure. It can be through facial tone, through talking about something secure. You want to really land it, get it in the body if possible, and then we'll decide with the client on what facial expression you're going to do, and then you can do that facial expression and then track it. And from there, you can either set up a reparative experience, like what does that hurt tell you, what's familiar about that hurt. You can draw it out more, the discomfort, and give it a reparative experience, or you can just come back to secure if it feels like too much, and then decide on with the client if you want to dive into the reparative experience of that one, or if there's another relational rupture that you want to work towards repairing. Okay, so she's saying, you could do that. We're actually going to do that. So, okay, Tim, can you hit play?
I have used it mostly in training to show implicit memory. I haven't used it as much clinically, but you could, especially if somebody has, like if you're doing, this is really great for couples work, because, sometimes we're triggering each other in our intimate relationship. If you're a best friend or, somebody you work with, sometimes we're triggering each other and we don't even know we're doing it. We don't know. It's not our responsibility. If you just happen to look sad one day because something sad happened, that might be very triggering for other people. But sometimes the other thing, so that's one point, right? The other point is we are unconscious of what our face is doing. So it's probably a really good idea to videotape your own face in a session when you're reacting to somebody. Or maybe it's with a friend, you're having a conversation, but it's so easy to tape now because you have your cell phones, right? But just videotape what your face is doing, because we don't know what our face is doing. Sometimes our face has a habit of doing incoherent messages, like you're saying yes, but your head's going like this. Yes, I really agree with you, but you're doing that. Like Beatrice Beebe was the one who she showed us this exercise, but she didn't do any resourcing. She didn't start with secure, and she didn't do any repair. She just had us do negative facial states, even like in contempt, all these different, one after the other, to show implicit memory. But people got so activated. I was in the room. I love her work. She's fabulous. She studied with Daniel Stern. She does all this infant parent stuff. And she did these fabulous videotapes I'll tell you more about when we have more time. Like she showed a mother changing a baby, and sometimes they don't smell so good, and when they're, it's not a lovely smell sometimes, changing. And so this mother, when she showed it fast, she was just changing the baby, and she was close to the baby, face to face, and it looked fine. We slowed it down, like frame by frame. She was actually showing contempt. And it might have been she did that from her own relationship history or attachment history, or it could have been the smell of the poop, but I don't know. but when you slowed it down, you saw the mother's one lip go up as contempt when you have an asymmetrical smile. Kind of, you have, I can't know if I can do it on command, but there's this contempt look that it's the easiest one to recognize because you kind of go, you know, your face scrunches on one side. I can't, for some reason I'm having trouble doing it. I'm sure I could do it, but right now I can't do it. But it showed the mother having that look of contempt and the baby freezing. And you wouldn't see it if you showed it normal speed. So it's so fast. And then she did a thing where she started filming with this one client. She filmed herself, not the client. And this client came to her, was referred by a psychoanalyst. So this client had been in treatment like 5 days a week, that whole thing you do, like the 5-day-a-week thing. And she had hair that she would put in front of her face, and she never looked at her therapist, and she actually never looked at her husband. She made no eye contact. She hid behind a veil of hair all the time. And so the psychoanalyst had seen this person for, I don't know, I can't remember exactly, maybe 5 years, a long time, and nothing had changed. They said, would you please see this client? She's like, oh man, I don't know if I can do anything. That's a really complicated. But what she did that was so brilliant, as the client had the hair wasn't looking at her, she filmed herself, not the client, and at the end of the session, she sat next to the client, so the client didn't have to look at her, right? And they watched the video together, and the client could look at her on camera, but not on the screen, the projector, the videotape. And she said, oh, you're not judging me. You're not looking with hate in your eyes. And she's like shocked, right? And so this could be a really powerful intervention. And so, but what Beatrice noticed when she was watching herself, that was great. She was so concerned for this client. She was sort of like, you know how you really focus, you knit your brow? And she said, when she showed it to her colleagues, they said, I've never seen you look like that. You kind of look mad. But she wasn't mad. She was just like really, you know, concentrating. And I've had other therapists say that sometimes their clients say, are you mad at me? And they go, well, no, but they have this look of, you know, intensity. And so you got to be careful, like, because you know, that's tricky. And then she herself and her colleagues noticed that when she was saying yes, her head was going like this. And she said, I had no idea I did that. That's really incoherent. So she said, I had to like kind of pay attention, or, you know. So anyway, so it's a good idea to film yourself once in a while, just to see. I've got a lot of films of me, and I'll see all sorts of crazy stuff. But it's important that we learn a little bit more about what our face is doing. So let's do this exercise. I think you'll find it interesting. And remember, just keep reminding your partner that this is not what you're thinking or feeling personally. This is an exercise. You want to reinforce that, because when we go into implicit memory, it feels like it's happening now. So you have to reassure people. You heard me do that over and over again, right? So we're just going to take, it's 4:13, take you a few minutes to find your location. We're just going to take 15 minutes. So, and again, you might spend that whole 15 minutes in the secure smiling state, which is fine, just tracking that, embodying and anchoring that resource, or you might try some of the negative states, depending on where you are at this time of day. There's no wrong way to do it. You can observe if you don't want to participate. And so one person will be working, you know, like with the different, giving the facial cues for, like, let's say 5 minutes. It shouldn't, we didn't use much time. And then the other person does it for 5 minutes, and then maybe you have 5 minutes to talk about how that was for each of you, like a little bit of debriefing at the end. Okay, I'm just checking in with you. How was that exercise? Did you learn anything surprising or unexpected? Let's kind of bring our really good example of indiscriminate chatter, right? Like on the movies. Here's where we put indiscriminate murmur.
Daniel, do you want me to keep going with the
Yeah,
feedback?
it's valuable. Yeah, totally. Yeah, this is the point.
So just, I'd love to hear a couple of you share your experience. Like, how was that? What did you find out? How was it, the different facial states, and then how was it to recover? Did you all recover? Yes. Oh, there's a microphone coming. Oh, whoever wants to thank you.
I had her do some faces that my mom used to make when I was growing up. And she did, which one was it? Was it the contempt? Contempt. And
That's a tough one. That's a relationship killer, actually.
Yeah, and you know, when she had the contempt face, I felt it here in my gut, but then my reaction was want to come back at it. You know, like
Right.
come back.
Beatrice,
Right.
you-
Mirror
Like
it.
I'm gonna,
Yeah.
you.
Yeah, that makes sense.
Somehow.
Right?
I'm
The
gonna get you
revenge,
back.
revenge, contempt, look back, right? Yeah, when you also mirror neurons, right?
Yeah, which is
Yeah.
interesting.
And then were you able to move into the
Oh, yeah.
resiliency again?
Move into it.
Yeah, so it's really important. It's such a learning, isn't it, how deeply that goes? Yeah, my mom was a big on contempt too. I can share that experience a little bit.
Okay.
Hi there.
Similar experience with the mirror neurons where when she did the still face, I felt this drop of just collapse internally. And when I told her that, she said, "That was interesting because that's exactly how she experienced going into that. Was just
Just
letting
emanating it,
her-
yeah.
Yeah, letting her entire being just go flat.
Collapse.
And
Yeah.
exactly what I felt at the exact moment. And then the other interesting thing was...
So you were in attunement, but a very negative state.
Uh-huh,
Yeah.
uh-huh. And then the other, I guess, interesting thing was she said that when we were in repair mode, that she felt that I wasn't making eye contact and I was just looking off. We were talking about it and how
Right.
interesting it was and a lot of things. But I think that that reminded me of what you said that infants do when they just need to just
Have some space.
readjust or whatever,
Yeah.
and not be necessarily so intensively focused.
Right, especially coming out of
To
still face.
regulate, right.
Right? Yeah, that's such an awareness. Isn't that important to understand ourselves, but also understand our clients and other people? And that's really valuable. Thank you for sharing that. It's really valuable. Anybody else have that experience of when you made the face, you also went into the feeling state, which would make sense because we're hooked up to do that, right? Yeah. Yes.
I had an interesting experience also in terms of maybe experiencing the secure attachment piece, because even though we were trying to do those phases, a part of me was also holding on to the relationship, so it didn't really affect that much. I didn't really arouse that much because I was kind of holding a little bit more with the secure that the overall relationship makes me feel.
Yeah.
Which was interesting in terms of also, to your point, that you can actually mess up and there is still enough space for repair because there is enough base in the relationship if there is a trustful relationship
And some part is also aware this is an exercise.
Maybe too,
You know,
right?
but extrapolating from your experience today, just see if you can pay attention to reactivity to facial cues or lack of facial cues, right? Still face is a lack of facial cues because it's a strong message to our attachment system, our amygdala, our nervous system. Just see if you can be a little bit, have the radar on for that the next couple of days even, like how the hotel staff interacts or doesn't interact, or how somebody at Whole Foods interacts or doesn't interact. Just to notice what's going on in your implicit memory triggers, you know, because it can be such valuable information. Thank you.
Stronic, I think Stronic, when he did the still face,
Edtronic? Yeah.
2 minutes the mother was flat.
Yeah, that's a long time.
Oh my gosh. And I remember looking at that, and I think I would fall apart just as much as baby did if that went on that long.
Well, how many people have seen the Edtronic still face? Because I have it to show you, but so many of you have seen it, and it is on YouTube. So I don't want to like overload the group with 2 minutes of still face, but it is painfully impressive. I don't mean impressive in a good way. How distressing that was to the children, and how sometimes they were inconsolable and sometimes angry. And I mean, it is a very strong signal. And here's the thing. When we have unresolved trauma, many of our clients and sometimes ourselves, we will lose facial expression has a lot to do with social engagement, even positive. You know, we have negative emotion too, but there's positive emotion. And sometimes when you are we're going to talk about this tomorrow with polyvagal, a dorsal vagal state, all the innervation of your facial muscles, the skin on top of your muscles and the muscles themselves, you don't have those cranial nerves turned on. It's like a light switch, right? They're not turned on. Doesn't mean they can't get turned on with the right work, but you can actually be feeling okay, but still having a flat face. So you lose your ability to communicate emotional states facially. And the interesting thing goes with that, you don't read, when you're in that state, you don't read other people's emotional states correctly. So somebody can be smiling at you, like authentically friendly, and you could read it as anger because you're in a threat response. So you're reading your environment, the neuroception of the worldview or the person, your partner or whoever it is, you can be misreading them in a really major way. You don't have the circuitry turned on when there's not expression in the face, whether it's positive or negative expression, right? But we're kind of focusing on negative facial cues right now. It's a little bit different of a focus. But it's real, like I told this story before, and probably those of you that are on the online courses might have heard it, but it was so impactful to me because I had this amazing, highly skilled therapist that had just moved to Colorado and came in for several sessions and was working a really intense car accident and also a really difficult relationship with her father, right? So we did all this work, and really her resiliency, she felt not triggered by the auto accident anymore, and she felt really done. But I was concerned because she was trying to build a private practice, and she had this very flat affect. And I thought, how do I say this? Because you're not really an attractor beam to people, when you have this flat face. And I thought, if she's trying to build a therapy practice, it's going to be hard. So I said to her, I know you're ready to leave, and I'm not trying to hold you into therapy or anything, but I'm concerned that there's not a lot of movement in your face yet. However, we can address that because it communicates, and I know this is how you feel because she's this lovely person and really wonderful. I like her so much. But I thought this is going to be maybe a block. So if you're willing, I think we need to do a little more work till we get the social engagement system turned on, the cranial nerves working so that you're showing what you're actually feeling and have that certainty.
Can you pause it here, Tim, too?
I was attacked.
Just on that point, Diane's talking about, flat affect, bringing, as you wake up your attachment system, the flat affect can wake up, your facial expression can wake up more. I used to actually have clients take really flat clients when they come in. I'd say, take a photo, take a selfie, a photo of yourself every day or every time after our sessions. And so you can track. So it's a really amazing metric. So if you get really flat clients, flat affect clients, you can give them that marker of, I'm actually getting better. It's coming online more. And you can see the progression of the photos. So yeah, just thought I'd throw that in here. Go ahead and hit play, Tim.
And she understood it, and she, we did more work, and she got more of her social engagement back. But you see how just that experience you had for a microsecond of still face, not the 2 movements that are going to put you through 2 minutes, that would be hard, right? To socially engage from that place, and to be read correctly. So anyway, I think it's a powerful thing. Anything else anybody wants to share? Yes.
Hi. I had a really interesting immediate response to the neutral face in that I immediately experienced my mother, and
Impressive how fast it is, isn't it? I mean, and even how brief the facial expression can be and how much it can trigger. Yeah. Milt, or whoever she's tracking, whose hands go up when they go up.
So can you pause it again, Tim? So if and when that kind of transference comes up, doing this still face, if you're present in your body, it really should bring something up. Don't worry, don't freak out. It's totally okay. And it's actually a real opportunity for repair. So just if you're in doubt, something gets to be too overwhelming, you just go back to secure. You just work on embodying secure. I know in some of the other trainings I've helped facilitate, emphasized a lot that the attachment system is so foundational in our brain so that this work it's very simple, but it can cut to the core of it. So it can feel like a lot, but That's good. It's getting evoked to be repatterned. That's what we're doing here. So go ahead and hit play, Tim. I think this is the
Thanks,
last
your
question.
Hey, Lisa.
Hi. So I was paired with Laura, and Laura and I did dARE-1 together. So the funny thing was, she like went to do her angry face, and like I think I kind of just mirrored her for a second, and then I was like, "Yeah, your angry face is not good enough."
Your angry face is
It's
what?
not good enough. Like I was
Oh,
just like, your
you
angry
got to
face-
do a sterner angry.
Yeah, I was
Yeah.
like, I can't. Like it's Laura. She's such a lovely person. She's not angry at me. So it was kind of that override. But it
Well,
was.
you had, I mean, really, that's the reality. We're kind of
Yeah,
doing
absolutely.
inauthentic manipulation of face right now, but yeah.
But even then, it was that half second of mirroring.
Yeah.
Like I unconsciously, like her eyes kind of bugged out, and I could feel my eyes bug out, and I was like,
that,
"Oh,
that
it's so quick."
mirroring, yeah,
Yeah.
mirror neuron.
And
Yeah.
then I like to think about, okay, so we see that, and then what are we encoding it as? Like you were saying, like if our filter, like I even think about like depressed people, right? So if your filter is depression, it doesn't matter what the other person on the other side is doing. It's like, oh, they're mad at me. Oh, they think I'm awful. You know, so that very quick like interpretation or that very quick assessment that we make in the moment, and then like our thoughts or whatever that kind of follow that are very interesting. So
Yeah. Thank you. Yeah, that's true. Thank you. No, and then I think we'll go into doing a demo.
I had a hard time showing anger. So I switched to grief, and
That's fine.
my partner said, "Your grief has anger in it."
Ah, so you got the mix,
So-
combo package. Yeah, yeah. But which anger is, I mean, anger is often involved in grief. Yeah, yeah. So how was it just to be with that experience for a moment? Because I can see it impacted you. Might be bringing up grief.
I experienced a lot of grief in the last number of years, so I was able to go there. And I hadn't recognized the anger that was in it. And I grew up with grieving parents, and now I realize that there was a lot of anger in their grief. So,
That's a big awareness now. That's
Yes.
a little bit new.
yes.
Are you comfortable just kind of sitting with that and allowing it to be there?
Yes.
Okay, okay, okay. And again, anybody who needs a little stabilization at the end of the day, please let our assistants know, because we don't need you to hold on to something that's too dysregulating for too long a period of time, but sometimes we really need to be present to the pain of our experience to let it process through, too. So just want to know that you have options, and, you know, both are important. So, okay. All right, so I thought I would do